Thank you. So, good afternoon, everyone. First, I would like to thank OIFE for giving me the opportunity to share with you the results that we obtained with our cell therapy clinical trial regarding, of course, in the context of pain. So, as I was telling you, so we have performed a phase 1 multi-center cell therapy clinical trial in Spain that consists, the objective of this clinical trial, it was to evaluate the safety and also the therapeutic potential of 5 infusions of mesenchymal stem cells applied to 2 pediatric patients in Spain. In this case, it was a 9 years old girl. She presented moderate phenotype and also a 7 years old boy with a really severe form of the disease. So in our case, the mesenchymal stem cells, they are derived from bone marrow that is donated from the histocompatible siblings, okay? The 5 infusions took place along 2.5 years, plus 2 years of follow-up as requested by the Spanish Agency of Medicine. So this is the protocol that we did in order that you have an idea of what we have done. So the first step, of course, is the recruitment of the patients and also the histocompatible sibling. The sibling underwent bone marrow extractions. The bone marrow extractions, it was a process in order to isolate, to characterize, and to expand the mesenchymal stem cells. This has been done in Madrid, in Spain. So the day of the infusions, the cells were sent to Bilbao, to the Hospital de Cruces, that is where everything was performed. So the infusions, the cellular infusions, were performed in the pediatric intensive care unit as a precaution, since none of the patients were immunosuppressed. Of course, we have a clinical evaluation with different monitoring and the follow-up visit, as you will see. So we took advantage of this clinical trial in order to study the host response. So for that, what we did is to analyze the sera collected before the clinical trial, to start the clinical trial, and also at different time points after the 5 cellular infusions. Also, we collected at 1 year and 2 years in the follow-up period after the 5th and last cellular infusion. In that way, we were able to study, to perform the molecular studies in order to elucidate the mechanism of action of these cells. So I'm going to tell you a summary of the results. However, I mean, these results have already been published. Because the objective of today, it was to center in pain. So anyway, I'm going to tell you about the summary. So after the 5 infusions during the 2.5 years plus the 2 years of the follow-up, it was not reported any adverse effect in neither of the 2 patients. What we saw, it was a tercel OI that is, sorry, I didn't tell you, is the code of the clinical trial, sorry. So tercel OI was associated with an improvement in bone parameters, such as bone density, and also bone microstructure, a reduction in the number of fractions, And also what we saw, it was an increase in the mobility of both patients and the realization of activities for the first time. The molecular studies, what indicated it was a functional prosteogenic response as a consequence of the cell therapy that were supporting the clinical findings. Also, what we found, it was an improvement in the quality of life. And this is what I'm going to talk today. So in order to evaluate the quality of life, what we use is the questionnaire that Mercedes Rodriguez was telling us yesterday, that PDS-QL, that is validated, of course, in Spanish. So this questionnaire consists in 23 items that are separated in 4 different functioning categories, as you can see here, like the physical functioning, emotional, social, and scholastic. So in the physical functioning, one of them is pain-related. That is the one that I'm going to show you. So this questionnaire was reported before the cell therapy, after the 2 first infusions, after the 3rd, the 4th, the 5th, and 1 year in the follow-up visit and in the 2 years of the follow-up visit. So in the case of the boy, what we can see is a reduction in the pain that is reported from the point of view from the parents in green and also in yellow from the patient himself. In the case of the girl, also, we are able to see reductions. However, at 1 year of the follow-up visit, the patient at that point, she was 12 years old, and she was struggling with the acceptance of her illness. So psychological support really helped her to overcome this situation. And actually, as you can see here, at the 2 years of follow-up visit, the girl and also her parents, they reported a total absence of pain. So we can conclude that the 5 infusions of mesenchymal, bone marrow mesenchymal stem cells in both patients, they really have an impact in the pain relief of these patients. This is the most important part of the talk. So I would like to thank, of course, the patients and their family for their unconditional trust and collaboration. Of course, all the collaborators, professionals, researchers, and clinicians, especially to Dr. Blanca Jenner, an excellent clinician, and she was the clinical coordinator of the clinical trial. And of course, the funding agency, especially to the OIFE Foundation. They have been amazing with us, with their support and collaboration. And of course, thank you very much for all of you. I'm the last one, so thank you very much.
Someone have any question?
Yes, over there.
We have time for 1 or 2 questions.
Hi. I was wondering how you know that the decrease of pain is because of this medicine and not because the children getting older.
The children getting older? What I understood from this workshop is that the older that you get, more pain that you have. At least is what I understood here. I don't know if I'm right or not. I don't know.
I think maybe I was also thinking about that because, you know, when we have OI, it kind of fluctuates. we have some years where we have some good years, and then we have some bad breaks, and we have some bad years, and so.
Yeah, but I think what I didn't show you because I didn't have time is, as I said, a reduction in the number of fractures. That was, quite remarkable.
Yeah.
So I think that it makes sense also with the improvement that we saw in the bone parameters. So I wouldn't think that the pain relief is due to other than, the improvement in general, also in the quality of life of everything.
Yeah, so there's multi-factors.
Yeah, of course.
Yes.
Yeah.
Good, okay.